The supply chain of our public health system, particularly transportation and distribution of family planning products, is a complicated process which requires flawless functioning of each of its components. Let's see what a perfect healthcare supply chain transportation system looks like. At the beginning of this chain is the state warehouse, which contains consignments of healthcare products. From there, they are shipped to a district warehouse, then to a facility. In a perfect system, the transportation of the healthcare products has to be uninterrupted and at a frequency which does not allow stockouts to happen. However, in complex systems like supply chain with multiple touch points, the risk of something going wrong is higher. And in a vast country like India, ensuring a properly functioning supply chain and last mile delivery is quite challenging, even for organizations with the biggest networks and largest resources. In particular, there are very few alternatives of transportation available to the government to distribute family planning commodities to ensure availability of contraceptives in health facilities. In the pursuit of strengthening the supply chain, we discovered that one of the problems that affects the entire system originates at the very first stage: transportation of the goods from a state warehouse to a district warehouse. State to district distribution is affected by many factors such as malfunctioning vehicles, wait for a critical mass for large vehicle, and so on. Another major blow to the transportation process was dealt by the lockdown in March 2020 as vehicle movement became extremely restricted. To tackle the challenges arising at the state's level, we saw a need to implement an innovation which was right in front of us all this time. Who has a better capacity, outreach, and last mile connectivity in India than the largest postal network in the world? Therefore, PATH facilitated a partnership between the government and India Post to undertake the delivery of consignments of family planning commodities to district warehouses from state warehouse. The state government of Odisha and UP accepted this innovation as India Post is a government organization with a long history. This collaboration allowed us to reduce the average delivery time to less than a week with zero pilferage or damage. First 2.5 months of operations, we were very successful and promising, but in March 2020, the COVID-19 lockdown was imposed all over the country. But being an essential service, India Post became an indispensable partner as they could continue transporting the consignments when the rest of the country came to a halt. In addition to that, India Post successfully satisfied the urgent requirements of small consignment to district warehouses. From January to August 2020, more than 400 consignments were delivered. 332 were transported in the times of lockdown. In other words, almost 4 tons of family planning commodities were distributed over 110,000 kilometers in just 5 months. This simple step of inviting India Post as a partner in the endeavor of reinforcing the supply chain of contraceptives allowed us to ensure a 95% timely delivery of the consignments to district warehouses and more than 80% of stock availability in them. Odisha and UP have already seen the change. If every state in India adopts the same model, together we can strengthen the supply chains and provide a very effective choice of transport partner to state governments, ultimately resulting in better availability of health commodities in facilities.